afternoon, everyone, and a very warm welcome to all our attendees joining us today. And we are delighted to have you with us for this special session on brain and bedtime sleep, organized by ONUS Robotic Hospitals, Hyderabad. Very warm welcome. In today's fast-paced world, sleep often takes a backseat. But did you know that it's one of the most powerful ways to protect your brain, boost memory, and prevent neurological disorders? To help us understand this fascinating connection between the brain and sleep, we have with us Dr. Tejaswi Rao, interventional neurologist at ONUS Robotic Hospitals, Hyderabad. Dr. Tejaswi Rao has been at the forefront of advanced neurological care and brings immense experience in treating complex brain and sleep-related conditions. Through this session, she will guide us on how sleep impacts brain health, the science behind restful sleep, and practical ways to improve our sleep quality for better neurological well-being. So without further delay, let's welcome Dr. Tejaswi Rao to take us through this enlightening session, Brain and Bedtime Sleep. Please go forward, Doctor.
Thank you, sir, for this warm introduction. So I hope you're all alert and active today, but by the end of the session, I might as well just convince you to have a nap. So welcome to our session today. So brain and bedtime. So how is it related? So basically, to understand this, we should know that what is a circadian rhythm. Circadian rhythm is a human biological clock which goes around about the timing of light we see, sunrise and sunset, and the hormone release in the body accordingly. So we have an approximate circadian rhythm of 24 hours, but actually it may vary from 13 to 20 to 52 hours actually, but the average is around 23.15 to 24 hours. So how does the body regulate within this 24 hours? So there is not only just the light outside which we see are changing, but also the light inside our body, which is nothing but the temperature or heart rate. Everything changes according to hormones based on what we see and how our body is tuned to, which is called circadian rhythm. So you can see in this picture that around 6 o'clock is your highest, 6:30 is your highest blood pressure. You're on the most active heart related functioning in that time. And around 7 o'clock, you'll have the highest body temperature. Around 9 is when your melatonin is secreted. So that around 9:30, you should be sleeping. And your deepest sleep comes around 2 a.m. And around early morning 4 a.m. is when your sleep and temperature comes out to lower side. So you should be getting up around 4:30 to 6:30 in between that time period. And that is when your melatonin stops secreting at 7:30 and you're back active and ready for your day job. That is how a body circadian rhythm works. And how are we affecting that circadian rhythm is what actually causes disorders in brain, which is what we are here to discuss today. So a healthy human being will have three phases of sleep: awake and sleep. In sleep, we are further divided into REM sleep and NREM sleep. REM means random eye movement sleep, and NREM is non-random eye movement sleep. So NREM sleep constitutes about 75 to 80% of our sleep, which is actually not the deeper part of sleep. And REM sleep constitutes about 20 to 25% of sleep. So in this picture, you can see how our sleep fluctuates between stages of sleep, like random and non-random. Amongst non-random, we still have N1, N2, N3, and N4. N4 is the deepest part of our sleep. So how the sleep cycle, each and every cycle of this awake REM to non-REM fluctuates around 4 to 6 times every night. It is not like we have deep sleep from this hour to this hour. No, it doesn't work like that. Within the sleep also, we will be fluctuating between lighter sleep to deep sleep. But what we are more concerned is that total number of hours we slept in deep sleep, that is stage 4 of NREM, is what the main functioning of the brain is up to. So this is a picture which shows that how it circulates between neurohormones and day and night. Also REM sleep, the random eye movement sleep, is the time when we actually dream. because NREM is deeper. So we actually dream in the lighter sleep. Everything we think and dream about in the non-REM sleep does not record in the memory. So we never remember if we dream something in an NREM sleep. We remember something, anything, most probably if we wake up from a REM sleep. So this is how for a particular minute, if we are in sleep, each and every part of the brain is interconnected via hormones, and we see and we dream whatever we are most subconsciously thinking about. So sleep is broadly divided into stage 1, 2, 3, 4, 5. Stage 1 is a REM, that is a light sleep. Stage 2 to 4, 5 are NREM, N1, N2, N3, and 4. And in these stages of sleep, we are more concerned about how we file and store our short-term memories to long-term memories, how we restore our energy, how we repair whatever, just in case some of the parts of the brain or functioning or neurons are damaged. We regulate our emotions, whatever subconsciously we are feeling, fear, happiness, or even anxiety. All these are actually regulated and formulated in a proper way during this. And it also resets our mood. So our mood is also dependent on the level of NREM sleep that we go through. So this is a picture which says that when we look into light, that is how the biological clock, that is a hormone, the pituitary gland in the brain, start working. And then it interconnects with multiple hormones, and pineal gland is the one which secretes the hormone called melatonin, which helps us sleeping. Also, it is regulated and it regulates our body temperature and heart rate via its connection through the spinal cord to the multiple organs of the body. So, how much does one sleep or needs one sleep? In adults, approximately 7 to 9 hours of sleep is necessary. In teenagers, around 8 to 10 would be accepted. But in kids, 9 to 12 and maybe even 14 hours of sleep is actually very good for them, because that is the time where the majority of brain and neuron functioning develops. And unfortunately, when it comes to new parents, you can try as much sleep as you want, as you can. Where do we lose this battle with bedtime and brain? So the blue light is a big villain the present scenario, where the phone screen and the tablet or TV screen emits a lot of blue light, which is what disturbs our biological cycle. So another villain is the caffeine, the late night caffeine or late evening caffeine, which disturbs our hormones. Late night dinners, because there's a regulation between gut and the brain when we eat something, the release of sugar and glucose and conversion to that. So all this happens after we eat. But unfortunately, we are not supposed to eat after 7 o'clock. In case we have late night dinners, brain is now becoming active again to take care of the food function first, hence delaying the sleep time. Last but not the least, stress and overthinking always disrupt sleep, like we all know. So what exactly happens? Like we discussed, the functioning of a proper sleep is to repair and heal when there is a REM loss. Basically, the sleep hours in the REM sleep are lost. We have increased in the bad hormones, we can say, or bad neurotransmitters, which causes activation of a defense mechanism. Defense in the sense, it should be active only when a bacteria or a virus affects our body, but unfortunately, these gets activated by a wrong signal, thinking that brain is not sleeping because there is a problem. So, which in turn causes more inflammation in the body. And there is a less clearance of the waste products. That's the debris which is actually cleared in a proper sleep. It gets accumulated over a period of time. And one such debris or a waste product is called A beta. A beta amyloids. So this is one of such products which, when not cleaned on proper regular timing over a period of time, ends up into dementia. The common Alzheimer's dementia happens because of accumulation of this A beta amyloid. So basically, that is what we're discussing. So the irreparable damage, because this does not happen because of one day loss. This happens over a period of time, and the waste gets accumulated in the brain. And once it goes to a stage that it is disrupting the normal functioning of the brain, that is when the symptoms come out. And which is mostly beyond 70% damage is when the symptoms come out in cases of Alzheimer's and Parkinson's disease. So, what are the broad classification of sleep disorders? A huge topic. I won't be able to cover everything today. So, starting from parasomnias. Parasomnias means people talking in sleep, walking in sleep, biting in sleep, and urinating in sleep. All these are actually sleep disorders. Happens because there is some disruption causing there is imbalance between how the body tone should be during sleep. Sleep relating breathing disorders like obstructive sleep apneas, hyperventilation syndrome, insomnia, chronic or short term, not able to sleep on time. And then sleep related movement disorder. Simple example that we have jerks in the legs when we are sleeping. It is normal when we are having these jerks during the transition between wake to sleep and again in the morning from sleep to becoming awake. But when it happens in your deep sleep, this is where the problem starts. That is called restless leg syndrome, commonly seen in pregnancy with iron deficiencies, but there are much other reasons for this restless leg syndrome. And this is also a sleep related disorder. And there are other central disorders like narcolepsy, where we fall asleep within milliseconds without a warning sign while walking, while driving, while talking, which may be very hazardous to the patient. So, and the simple and common one we all experience is jet lag when we are traveling from west to east or east to west, based on the change in the timeline of our world. So, so based on these kind of disorders, there is always change in the neurotransmitters that actually causes these disorders over a period of time, much leading to accumulation of the waste in the brain, hence causing irreparable damage of the brain. So, how do we know that the sleep has gone wrong and it is time to intervene? You're frequently getting awakening in the middle of the night. It is affecting your social mood and your work life. It is you're sleeping for many hours, but you're always waking up unrefreshed. You're having excessive fatigue all during the day, and in spite of a proper nap, you're not feeling that refreshment. Mood disturbances, being groggy all the time, reduced motivation, depression, multiple accidents because of this narcolepsy, because you're falling asleep like that, and unnecessary anxiety, and overall decreased quality of life. These are the simple but very important symptoms where the sleep disorder can be identified in the early stage. However, the earlier the better, but lot of people ignore these things thinking that it is just fatigue or I'm just tired for some other reason. So, how do we evaluate? We have something called sleep study. So, we will be assessing the movement of hands and legs, breathing, heart rate. We will put a tube, or what do you say, a monitor in the front of your nostrils, which monitors the breathing quality and the quantity. And there will be EEG leads which will be placed on your head, which will determine your brain activity and which stage of sleep you are. So once we collaboratively assess all the values from your limbs to heart to chest to head, that is when we come to a conclusion that what possible sleep disorder it is and where could we intervene. So this is the left side image is where the type of waves we can see in sleep, and the right image is actually a perfusion scan which we can do while we are sleeping, and you can see that in REM sleep we are actually pretty active. Compared to awake, it is less, but we are still active. You can see the red areas of the brain which are actually still functioning and dreaming when you're in REM sleep. In NREM sleep, it all suppresses down and the brain is in total deep sleep. So, what are the magic tricks for better sleep for conclusion? So, follow a proper sleep schedule in weekends also, because consistency is the key. Second, digital sunset. Turn off all the blue light possible screens at least 1 hour prior to your bedtime. Third, make your bedroom, that is wherever you're planning to sleep, make it a sleep zone. Keep it quiet, dark, and cool. And make sure that there are no work calls. So basically, no phone inside your bedroom. And watch on your caffeine intake, because you should not take any caffeine after 5 p.m. I would actually not recommend a tea also, but caffeine for sure. And mind dump before bed. That means if you are stressed about something, we always say write it so that it comes to a clarity and then you can sleep on it. That will have a better effectiveness than thinking in your brain and clogging it with multiple random thoughts. Move during the day, because exercise and importance of exercise will give you endorphins and the timely release of hormones so that the brain can rest or deserve its rest in the end of the day. And no physical exertion or no gym or workout before bedtime. This is not only going to disturb your sleep, but also it will worsen the quality of sleep. So every time, remember when your battery of phone is dead, you go and plug in your phone to a charger. So remember to plug in your brain tonight and give it charging by giving it a 7 hours of minimum guilt-free sleep. Okay, there are multiple medications where benzodiazepines and barbiturates, which are nothing but um, they release more of a sleep-inducing neurotransmitter in the brain. There is something called orexin. Orexin is one such other hormone released in the brainstem which regulates the sleep and which is the one which is deficient in narcolepsy. So we have lot of drugs which can directly act on that particular place where patient needs it. But before doing that, we need to understand what kind of a sleep disorder it is and how all the body is affected. Is it limited to the brain or is it also associated with breathing and movement disorder or heart disorder or a dementia? So only after analyzing properly we can start the treatment. Please do not take over-the-counter medications for your sleep because they are not only dangerous but they'll miss the proper treatment because the diagnosis is not proper, and also this causes sudden depression of your brain and brainstem. So your thermostat of your body is suddenly going to get depressed and it may affect your breathing and slow down, which can cause sudden deaths in sleep. So we should never go for over-the-counter medications to induce sleep because not only it risks death in sleep, but also it will get dependency over it. So be very careful when you're using a sleep medication and give your brain the rest it deserves. Thank you.
Thank you so much, Dr. Tejaswi Rao, for that insightful and eye-opening session, and on how sleep impacts brain health and overall wellness. Now we'll move on to the Q&A session. If you have any questions, please type them in the Zoom chat box or the Q&A box, and we'll take them one by one. Doctor, we have a few questions here. The first question is, does the timing of sleep matter as much as the number of hours we sleep?
Yes, like we discussed, consistency. So for the to maintain a consistency, you need to have the timing proper. So number of sleeps, like we discussed, age wise and the work wise, we need a proper minimum 6 to 7 hours of a continuous sleep. But timing is more important because we are dependent on the melatonin that comes from the sunlight induced light in the body. So yes, timing is definitely important. For shift workers, there has to be some routine and there has to be some proper care through a neurologist so that they can maintain their body clock along with doing that shift worker. Because nobody is going to do shift work from the starting of their career to the end of the career. It is only going to be a temporary thing which they do in the starting of their career. So this should not affect their body biological clock. So I think anybody who is having the shift work related sleep disorder, they should be taking a proper neurologist opinion so that they can manage this temporary phase and not harm their biological clock. So yes, timing is equally important as the duration is.
Thank you for that answer, Doctor. Another question is quite related. Um, are short naps during the day beneficial for brain health, or do they disrupt the sleep cycle?
No, sir. Short naps doesn't disrupt the sleep cycle. The afternoon or daytime naps are usually not related to the overnight naps because obviously the melatonin is not there in the right place. Short naps work mainly for the fatigue part. If you're overstressed or overwhelming yourself because of whatever reason, whether it is physical or external or mental exertion, you can go for a short nap. It will help you refresh faster. It is like a short term pill or short term management, but it is not going to be supplementing your night sleep and not disrupting.
Thank you, Doctor. Um, Oh, I have another question. This is actually personally from me. Um, does taking like home remedies like having warm milk at night with some turmeric or something like that help with your sleep, actually help with your sleep, um, or doesn't it?
That's nice question, sir. Because I think from our older wisdom, wisdom from our older generation, they have been telling us taking warm milk will help. Like we discussed about circadian rhythm and the body temperature rising in the nights and coming down in early mornings, it is just going to add up to it. It's not going to ruin anything. I think it will help in one way or the other, but it is not necessary. It's not 100% necessary because body has its own thermostat to take care of the temperature. It may just add up. So it may help.
Thank you, doctor. Another important question we have here is, can improving sleep actually help in faster recovery from neurological illness?
Yes, definitely. Definitely. Because any neurological illness, starting from brain to spine to nerves, any disorder, it is actually originating in the brain itself. Because the neuron, the cell of that nerve is in the brain. The nerve is traveling all along the body to the limbs, but the neuron is in the brain. If you are repairing your brain cell, definitely over a period of time, regeneration and neuroplasticity is something amazing that helps us to create new things. But it will happen on its own and it will take its own time. So yes, by healing the cell and giving it time to heal itself, will definitely give us time to regenerate the new nerves into place where it is needed.
Thank you, doctor, for patiently answering those queries and for sharing such practical and valuable advice. I'm sure our audience have gained a new perspective and on the importance of quality sleep for brain health. As we come close to the end of today's webinar, we'd like to extend our heartfelt thanks to Dr. Tejaswi Rao for her time and expertise, and to all our participants for joining us today. We hope the session on brain and bedtime sleep helped you understand how simple lifestyle changes, especially good sleep, can make a big difference to your neurological well being. Before you leave, please take a moment to fill out the post webinar survey that will appear on your screen after the webinar. Alternatively, you can also fill it from your email ID as well. You'll have the link there. Your feedback helps us make our future sessions even more engaging and relevant. Stay connected with Robotic Hospitals Hyderabad for more informative health talks and webinars. Thank you once again and have a wonderful, restful evening ahead. Thank you and good day. Stay happy, stay healthy. Thank you.